Hey, everybody, it's Kevin and Zane from RPH Ally Digital Thoughts. We're at the Healthcare Tech channel, and we're talking about the Healthcare Tech show today. Hybrid care, is it the future model? So, one thing that you guys should know before I hit the clip and to tune in is I think it is. I think this is going to change the way that we practice moving forward. I think adopting both sides of the fence is going to be the case moving forward. And also, you guys all need to know before I hit this clip that Zane absolutely loves fax machines. So keep using them.
I do not love fax machines. I will not let that one slide.
Oh, I love it. I love how I can hit that clip and just cut it right through it. Fun. All right, buddy. We're talking about something you and I have talked a lot about. I mean, when we first met, when we were talking about some different technology platforms, a lot of our conversations revolved around what different entities were doing to move into the hybrid care model. Can you kind of describe, like, what do we mean when we say hybrid care?
Yeah, so hybrid care is what it sounds like, right? There's many ways to take care of our patients, especially since the pandemic. A lot of those have come to light, telehealth being one of them. So hybrid care for me is having like a hybrid model where you see patients in person and also via telehealth. People that have ever worked in clinics know, or actually patients even know, a lot of times you don't have to physically see somebody, right? And that and then there's a lot of annoyance that comes with going to the doctor's office. There's the time to get to the doctor's office, there's the waiting in the room and all these things. And if you're able-bodied and healthy like we are, I mean, it's just an annoyance. It's not it's not something that it's something we can deal with, but we can. But like if you're dealing with people that are more frail and are more, that it's hard for them to get to the doctor's office, get a ride, all these things, we shouldn't be putting up barriers to take care of them. You know what I mean? So, like, your background is in geriatrics, mine is in oncology. We both dealt with very frail patients that required. I mean, in my case, there was times where patients didn't have rides, and they would have to come like hours before their appointment, sitting in the waiting room, and then when couldn't get picked up maybe like right away. So, I mean, for them, it's not fair to have them come in, do all that for just like a 15-20 minute visit, and then what? You know what I mean? So that's what I mean by hybrid care. And I think in the future, patients are gonna want it. So like our generation, as it gets older, we're used to, we're literally talking over the internet, right? We're video chatting all the time. We're used to this medium to interact with people and interact accurately. And with RPM and all these other things coming down the pipeline, I think that if you don't have a hybrid model, you're going to start losing patients. And I think more patients are going to go to providers or systems that provide that hybrid model, because and I'm not a proponent for fully telehealth. I think that's all. I mean, there's some always the answers always lie in the middle. But to me, like, the hybrid model is here to stay for that reason, because healthcare, there's parts of healthcare that you can do via telehealth, and there's a lot of healthcare where you need to do it physically, right? Like, we can't do a physical exam. I mean, I guess, that sometimes maybe you can, I don't know, but I don't know if you can do a really good physical exam over the internet. But I mean, surgery can't be done, ED visits can't be done. If you have to go to the emergency room, physically see something, surgeries, all that stuff, we need physical things. But for like a general checkup, or if you have a question or something like that, I think telehealth is more than capable of dealing with those kind of things.
Yeah, I think I kind of bring it back to this. Did you like Blockbuster, Zane? And not to date ourselves, but Zane and I are old enough to remember Blockbuster and going in and being excited about the most recent movie being released. But did you like it? Did you like going in and checking out new movies?
Yeah, I mean, it was cool. Yeah, I guess it was nice. I mean, when we went to Blockbuster, it was usually, on a weekend where we were doing cool things, so it was associated with fun. So yeah, for the most part, it did.
Have you liked any of the times you've gone in to have to see the doctor and wait in the waiting room?
No,
I mean,
not at all. Ever.
the hybrid model in a nutshell for me. It's really like, what is an enjoyable, enticing experience? Yes, if you want to be able to go in and go to a spa, you don't want to remote the spa. Like, you want to be able to get the entire experience. Some experiences that are not as desirable are going into a busy waiting room when all you need to have done is refill a medication, right? Or just get a few things checked to make sure you're on the right path. If you're declining rapidly or having any other problems going on, making sure you're going in to be seen, establishing that relationship, keeping everything kind of in check, it makes a lot of sense. But I do think with the hybrid model, tele and in person, that's the hybrid of combining the two and kind of utilizing them in step. To me, the things that you lose through just tele, I mean, Zane and I, we've never met in person, which really bums me out, by the way. And we need to find a tech conference that you and I are going to. But we haven't seen each other in person, but it would add to the relationship. It would add to the feel of like I've visited with him, I've been with him, we shared a meal together, we've talked, in the same space. And so I think there's some trust, there's some nonverbal cues. Zane cannot see my legs right now if like I'm tapping back and forth or nervous. So there's a lot of things that I think as clinicians that we might not even know that we do, but we notice with our patients to make sure we're taking care of them, answering questions, seeing or visualizing that they're understanding what we're saying. And the in-person component of that, I think, is so valuable. Or, going through an instruction, Zane, of like, how do you administer this? Or how do you give this? Or how do you do this? Like you and I probably remember you do the injections on the orange. Well, guess what? Like the injections on the orange and the injections in a real arm, very different. Very, very different. Like I understand the practice models, but that's the same as in-person care. Like when you're trying to teach people about what they're going to experience, how they're going to feel, that in-person intimate relationship, especially oncology, geriatrics, folks that are maybe declining or having real struggles that you need to have that relationship with them. So there's trust. They want to reach out to you. I feel like there's only really one way to establish it. But the opposite side that you were saying, Zane, with the elements and being able to pull all those things together, man, the simplicity of just being able to call someone on the phone or look at them on a video chat and get something done without having to go through the hassle. There's no way consumers are going to let that go.
Yeah, I mean, that's why I think like the hybrid model is the one that's gonna stick, is because of what you just mentioned. Certain things are just better in person. As someone who is an introvert and doesn't mind that. Even me, for someone like me, I realized, over the last couple of years that in person is still better than over the phone, because there's, like you said, there's just a trust that gets formed. And then, but like, I don't think, like, for me, like the telehealth movement was good. 100% telehealth is not good, but I do like telehealth because it does theoretically increase access to care, right? And that, to me, like, I've seen patients where it's really hard for them to come to the doctor's office, where they've canceled multiple visits to see the doctor. And, if there was a telehealth, if we were able to do things telehealth, that canceled, instead of being a canceled visit, it's an actual checkup, right? And,
Right.
those are, anytime you talk to a patient is an opportunity to make an intervention and possibly, save their life, right? So that, to me, is why I think, that's why I'm a big proponent of telehealth in general, because it's not the best, but it's better than nothing. You know what I mean? And then I'm not saying that to put slight on telehealth, but I mean, I think that, if somebody is like, oh, I don't want to do telehealth or this and that, I would ask them, what's better, never seeing the patient or doing a quick visit over the phone or over a video chat? To me, I think 99 out of 100, probably 100 out of 100 people would say that. And then the other thing you can do is, with telehealth, you can decrease wait times in the waiting room. You don't have a completely packed, room, waiting there. You can maybe move things along, right? I mean, I think the way to do like hybrid care is not in, being like, okay, I'm going to see three people, then I'm going to do a telehealth visit. See three people do. You should, the ones that really work well are the ones that block off telehealth visits. Like, hey, every Thursday morning we have just telehealth or whatever, right? From this time to this time, it's all telehealth, and after that, it's that. Like, I think that's the other thing, is just the workflows of people that are working in hybrid models. Right now, it's very hectic. There's a lot of switching back and forth, right?
Nobody's good at that.
Huh?
Nobody's good at that. I mean,
Yeah.
there's just not. It's difficult to switch back and forth. And I think, like you're saying, when you're blocking things off and we're looking at everything, I think time, as you mentioned, is the most important piece. You can't get in to see your provider, or we can't even get the follow up we need, Zane, to be able to monitor appropriately. So, utilizing some of the things out there we've talked previously about using artificial intelligence and remote patient monitoring and some of the other things that are there, so that you don't necessarily have to see another human being. but you're being monitored in this hybrid model so that now those human beings, when you do get time to be able to visit with them, have highly actionable data at their fingertips that they can make sure changes are made. And guess what? If they don't have time and it's something that's more urgent, unlike you having to go to the ER, now they can catch it earlier and be able to take care of things earlier. So if we're going to move toward value-based care, Zane, I think hybrid is necessary. You
Yeah,
agree?
and agreed. And then you know what you brought up there, like there's a downstream effect to increasing touch points with patients, right? And a positive downstream effect. They're not going to the ER as often. They're not doing all these things because they were able to see you, whatever that happened, whatever term we end up calling it. But they're able to do that because I think that's that's kind of what's exciting with the value-based care model is you and I both know that chronic diseases, diabetes, hypertension, lipid, whatever, cholesterol, all these things, well,
Mhm.
they're lifestyle diseases, but they still are affecting your body. And you need to see somebody more than just a couple of times a year, right? Because, you know, and a lot of patients just get lost to follow up because, they've canceled an appointment and then they tried again, they canceled another one, and then they're just gone, right? Because guess
Yeah.
what? Everyone works during the hours of 9 to 5, That's the other thing that a lot of people don't understand is seeing your doctor when it's convenient for everyone is not convenient for anyone. You know what I mean?
Nope.
So that's the other thing with telehealth as well is you can theoretically do it during a lunch break because you don't have to worry about transit time. You don't have to worry about sitting there in the waiting room, all these things. You can go during your lunch break, before work, after work, whatever happens to be. And it's convenient for you. And I think that's one thing. The more convenient we make it to use the system, the more people will use it, right? And that's the other thing with this is like we need to make things more convenient. We need to make things easier for people and caregivers too, right? I mean, think about it this way, right? I mean, I wrote about this today about the caregiver experience.
Saw that.
you, you know you how much help would it be if a caregiver didn't have to like take off work or worry about driving their loved one, like, hey, they can't walk, we have to get them in the car. All Not everyone has capabilities like a van that has access to, just for disabilities. Not everyone has that. Not everyone is blessed to do that. So I mean, there's just so many things that you and I have both seen is so inconvenient in our system. Like, to me, like people like that would greatly, it would be helped so much by just being able to do like a televisit for them.
Oh, absolutely. I mean, that kind of convenience is just something that takes a huge burden off. And I love that you bring up caregivers because we're always thinking about the individual patients, but there's a massive ripple effect, and if we don't recognize that and we don't look at the social determinants of health, as Zane and I have talked many times, and we're not trying to actually take care of patients. And so we're missing the boat entirely. And so I think to end things off here, Zane, the one thing I wanted you to be able to point to be able to help people to understand, like, here's what's also happening to understand is this all sounds great. But what are the barriers to it today? Like, what are the barriers toward hybrid health being a reality in a larger setting?
Reimbursement, reimbursement, reimbursement. That is the biggest thing I think that is stopping it, honestly. I mean, the technology is there. I mean, there's companies that have hybrid, I mean, they have telehealth platforms that anyone can really use. And also, I mean, I would say maybe integration as well. There's not a lot of great great tech that's integrated with your traditional EHRs right now.
Yes.
But I think it's just all reimbursement, right? I mean, there's talk about clawbacks on telehealth, which is I think the stupidest thing ever. I think it would be just dumb. I mean, you can tell that it's made by people. These laws are being made by people that have no understanding of healthcare in general.
If
Um,
anybody's listening to Zane and I right now, and you have any pull with your state senators or you have any pull at the Capitol, I know Thea was at the Capitol today, so Thea, you go let them know this is pulling back or repealing telehealth laws because some people were taking advantage of it and doing the wrong things is a terrible idea.
yeah,
Alter it, pull out monitoring, make sure there's quality improvements, but patients need it. And there's some huge strides we were making with it.
yeah. I've never been a believer of creating laws for fringe reasons or creating for the fringes because what you end up doing with that kind of mindset is destroying the majority of people that are doing it the right way. And that's the thing, like, I mean, this is going into more philosophical debate than anything, but we're so scared of everyone like beating the system that we forget that no one, first of all, the people that are doing that are very low, right? And instead of creating things to identify those people, getting rid of the programs and things like that is not going to help. It's only hurting the thing. You're trying to decrease healthcare costs. The only way to really decrease healthcare costs is in, to get to people when they need it, right? Not to make it harder for people to use healthcare. And yeah, I can go on a rant for a long time about
Yeah.
healthcare in this country and who's controlling it, but I mean that's why I advocate for us to take the reins on these things. Whatever you're good at, get to the top of that mountain and start changing things from there. Because honestly, we can't do anything from where we are right now. Eventually, maybe enough of us can get to the top, and we can start really changing things there.
Yeah, I'm in full agreement, brother. I think the fraud, waste, and abuse stuff, yes, like it does happen. It has been problematic. One better thing to do rather than throwing the quote unquote baby out with the bathwater is for us to really start monitoring those things and making sure it's helping the populations that we need to have help toward.
Mhm.
So, on that bright note of let's help people and love people and optimize hybrid care, we're going to sign off here. If you guys need anything, you guys let us know. If you have any show ideas, send them our way. We have a pitch competition we're putting together. I've talked with a couple people with companies that I'm going to start moving into the pitch competition. So
Oh,
we're
sweet.
getting some folks, yeah, in the area, some local individuals that are doing some really cool things. And so
Awesome.
we'll get those things together, and Zane and I will get those rolling, and we'll let you guys know more details. Check out Digital Thoughts and all the ways that it comes to you, podcasts and blog articles, and head over to RPH Ally to Zane's channel. Ask any questions there. Give us your knowledge, and let's talk soon. All right, guys.
Okay.
Have a good night, Zane.
You too.